Welcome to Bite Size Dental Marketing. Today I have Dr. Adam Woods here. Dr. Adam Woods is a native of Grand Prairie and is deeply rooted in the community of Beaver Lodge, where his practice is currently located. Having played varsity volleyball at GPRC and then pursuing higher education at Edmonton, Dr. Woods is a well-rounded person both academically and athletically. He has a broad interest in all aspects of dentistry and is dedicated to being a collaborative partner in all his patients' journeys. Dr. Woods is committed to ongoing education to enhance his skills and serve his patients effectively, from attending conferences in Guadalajara about full arch dental implants to seeking day-to-day advice from his peers. He's someone always going the extra mile for his patients and in his craft. Besides his professional life, he also enjoys staying active, learning, and spending time with his loved ones. Dr. Woods, thank you so much. It's lovely to have you today.
Thank you, Ian. It's going to be fun.
So the first one that I always love to kick off with is, why dentistry? Because I don't think a lot of people wake up one day and go, I'm going to dig in people's mouths. And my dad, being a dentist, I've asked him this question many times in life. I said, Dad, did you just wake up one day and say, I want to dig in people's mouths all day and this is going to make me happy? Please share a bit about your story of becoming a dentist.
That's funny. Patients ask that every couple of days. They're like, why do you do this? Yeah, it's a good question. I think, to be frank, growing up, I didn't really think about it enough. Did well in school. Just kind of the assumption is, be a doctor or something. Like, that sounds good. So I just didn't give it a lot of thought, didn't look into it all that much. Shadowed a couple of physicians and stuff, but got into undergrad, and one thing led to another, and I ended up looking at both of them, dentistry and medicine, and it came time to make a decision, I guess, after getting into them. And then I did my homework and went and shadowed a bunch of people, and I looked at both sides and tried to make an objective decision. And it's one of those things where, like, stuff just works out really, really well. Like, I think for me, this is the best job I could have, probably. It gives me an opportunity to learn continuously. I mean, I could spend every second of every day learning and not know it all, right? Like, it's constantly evolving. There's new stuff out every day, new technology, new procedures, all that kind of stuff. I get to, get to know patients and watch them grow up over time and change and go through life stages and stuff. Obviously, haven't seen too many life stages at this point, but even just little things in the last few years have been really cool. I love having the opportunity to be a business owner. I mean, again, I get to take a team and kind of help them,
like magic,
develop a vision and work towards something. And you look at growth year to year, and people have hard conversations, and it's just really cool to watch them develop and turn into really, really cool people. I think ultimately, like, dentistry allows a lot of freedom, which is probably the biggest thing. Like, my personality's kind of shuffled me in a certain direction, but ultimately I think it kind of has something for everybody, really, right? I mean, you get over the whole working in people's mouths thing, and you don't even have to do that if you don't want to. Like, there's lots of other stuff you can do in that profession, but obviously that's kind of the majority.
It becomes a small part of
this. You cannot be a business owner.
Yeah. From what it sounds like, it becomes a small part of it. Yeah.
Yeah, it's you start to take that for granted and almost forget that that's what you're working on, right? And all of a sudden it becomes about, like, trying to impact people and make them more confident and more comfortable, and just make a notoriously unpleasant experience as pleasant as possible. Like, that's kind of the cool challenge too, right? Because I mean, everything's about managing expectations, and I feel like people's expectations are usually that going to the dentist sucks, it's not fun. And I agree, there's a lot of stuff that is uncomfortable and not pleasant, but I think you get a group of people who are working really hard to make it.
I always say it's Hollywood movies. I think it's Hollywood movies gave you guys a bad rep, because if I remember everything from Finding Nemo and the drill, the sounds of the drills and the pelican flying around in the office and whatever it is, I don't know why Charlie and the Chocolate Factory. I don't know why this idea was created, because as you're saying now, and even me thinking back to as a kid, growing up with a dad as a dentist, it was amazing to go to the dentist. I was like, I'm going to my dad.
Yeah.
Like, it's a great. It was no more scary to me than going to any other medical profession, or having to find out news. It's interesting, and I think I've asked another dentist this before, and it was about the fear of the unknown and the idea of the
Yeah.
unknown, and like it's a small space, it's an uncomfortable thing for people to do, and that's maybe why that, compared to somebody going to a physician or something like that, is maybe a different experience, because you have this idea in your head of, okay, they're going to put this here and feel this here and do this, whereas with a dentist it's an experience of I'm I'm down and my head's up and my mouth's open, and somebody else needs to completely take over. So I guess
It's a
that's
lot
part
of
of it, but
vulnerability.
yeah, a lot of vulnerability. I think that's a good point. And speaking of vulnerability, one thing that I have followed with your journey is the fact that you, of course, started your own practice, as you said now, and that is something I know that can't be very easy, because I have this vision in my mind, and I've said this before to many dentists and to friends I've spoken about for that matter. Dentists go to school to become a dentist for many, many years, and they get really skilled in their craft. And dentistry, I mean, my sister, like I said, my dad's a doctor, my sister is a doctor. Like, I saw this happen in my house. It becomes this obsession because you love what you do, and the idea of what you're going to be
Yeah.
doing and helping people, you love. And I see you smiling because I know you must have that feeling. It takes a unique person. But then you're thrown
Yeah.
into, okay, now run a business, now start a business, and now you must know what a lot of other people go and do business degrees for many, many years. Tell me a bit about your experience, and the hardships, and just advice to a younger dentist that's eventually coming into this, saying, I want to do this. What are some things you wish you knew a few years back when you looked at this?
How many days do you have that we can stay on?
I got time. I got time.
I
I
could
got
talk
time
about
for
that
you.
forever. Full disclosure, I have a business degree. I have an MBA, but
Oh, so that
I don't know.
helps a lot.
It like
I did not
sort
know
of,
that about you.
sort of. I mean, yeah, yeah. Like you think differently, but there's still a lot of stuff where it's like there's no. I mean, there probably is a playbook somewhere, but the playbook just isn't necessarily applicable to every situation, right? So
Mm,
I think like the biggest part of it, or the biggest piece of advice that I'd have for that kind of thing is take stock of who you are and what you want, right? Like I mean, when I came out of school, I didn't really know what I was getting into, right? You kind of form these ideas in your mind and get committed to them, and then emotionally buy in and all this kind of stuff. And I feel like I didn't really do a lot of digging to figure out like why, you know? So I came out of school and I'm like, oh, I want to buy a practice right away, and yada yada yada, and I
was it kind
kind
of
of
a
went
Jesus
down.
take the wheel? Was it kind of a Jesus take the wheel type of situation? It's like, I'll figure this out.
Yeah, which I think I do that a lot with a lot of the big decisions. I mean, that's what I did working right after school. That's what I did when I built this practice. It's a lot of like, yeah, I don't really know what I'm doing, but
But I got to do
um,
something.
I
I got to
always
do
try to,
something. Yeah.
yeah, yeah, like I'll work at it, and it'll work out just fine. It's a little bit different. You think about this versus treating patients. I mean, treating patients, obviously, there are people involved, and you kind of got to include multiple stakeholders and risk tolerances and all that kind of stuff. This kind of thing. I mean, most of it is on me. Obviously, there's a team and everything now, right? But most of the stress and the decision making kind of falls on one person. So yeah, it was an interesting story. Do you want me to kind of recap it a little bit? Kind of what?
I would. I would. I think it'll. It sounds like you've had a colorful journey, and I mean, wow, I'm impressed. I honestly did not know that you had your MBA in business. So this kind of goes against my theory of. Would you recommend that for dentists to at least look at a bit? Because it seems like it's a
So,
it's a good
so
move.
I gave a talk to some dental students a while ago, and they asked me that same question, like, should I do an MBA? And I'm like, no, no, like you don't. Yeah, I have a genuine interest in it, right? Like, I
Okay.
mean, if I wasn't totally caught up in what I was doing, like like I'll read a business book just for fun because it's cool looking at how people impact things positively and develop stuff and create systems and help people grow and
Hmm.
just again exceed expectations. Like for me, that's cool. That's like why I
I
do
didn't
stuff,
change it.
right?
Yeah, yeah,
Um,
yeah,
I think like a lot of the coursework was, I mean, it's kind of arbitrary, right? It's business is funny because it's so broad. I mean, aside from like, well, even accounting and all that kind of stuff, but you can take these ideas and then you have to like manipulate them and apply them to what you're doing, right? It's not like there's a course on like how to buy a piece of land, build a building, and then develop a dental clinic inside it,
yeah, yeah.
But there's some stuff on like budgeting and human resources and things that kind of give you a solid foundation. Just I don't know, maybe I take them for granted now. I'm not totally sure, but I certainly don't think you need to do the whole thing to be
To be
running a
a,
business. I think there's probably quicker and more efficient ways to do it, but
hmm.
it's helped.
But give me. I do want you to give me a little recap, if you can, just on that journey and the starting of the practice, because I think it's an important story to tell. As I mean, there's a next generation of dentists that's going to want to do this. The best piece of advice I ever get is speaking to people with experience. That is why. So, if you could,
Man, I'm flattered. I have experience. It's like weird to think about. I don't know why. I still feel like I'm on the other side of it. Yeah, so I came out of school. I knew I was coming home. Like I'm from Grand Prairie originally. I was born and raised here. It's like a city of 70,000 people, big oil and gas city in Alberta, Canada. And so there's lots of stuff going on. It's busy. There's always, people. There are always people coming here, and my family's here, friends are here, all that kind of stuff. So came here. I worked at a clinic where I knew the lady was kind of planning on transitioning out sooner than later. I was kind of like the main dentist there, 5 days a week. She only worked a few days. So for me, it was perfect. I mean, I kind of got to get a little bit of experience just in managing things by myself and seeing how things were run and all that kind of stuff. That was 2019. And right from the get-go, we were kind of talking about me purchasing and all this kind of thing. Ultimately, it didn't make sense. I mean, we probably went through that for about a year. And I was mentioning how you kind of get like emotionally attached to an idea, right?
mm-hmm.
So I was like, oh, I'm going to buy this clinic. Like, I'm going to make it
Mm-hmm.
work no matter what. And somewhere along the line, like, I don't know if it's, how many people it took, accountants, lawyers, whatever. They're like, Adam, maybe don't do this. Like maybe this doesn't make sense. Like it's just not a fit for you or whatever, right? And so eventually I was like, okay, yeah, no, it's not a fit. So that's okay. So I started looking at alternatives logistically. Like I had a non-compete in Grand Prairie, so I wanted to respect that. And Beaver Lodge is 20-minute drive. It's a beautiful town. People are great. It's just west of Grand Prairie. It's like a nice picturesque drive on a divided highway. You see the mountains, rolling hills. Yeah,
I
it's so
look. I
funny
looked at
because
the pictures.
people are
That's
always
nice.
talking about, yeah, it's beautiful, man. It's beautiful. We need to get you up here. Um, and I don't know. For me, like 20-25 minutes is like, it's time to get my head in the game, play an audiobook, whatever, right? So the drive's actually been kind of nice. But anyway, so I started looking out there. There was a need. There's one great lady working out there, but just doing a few days a week. That's the town's about 3,000 people, and then there's probably about 15,000 people surrounding area. So there's more of a demand than what was available. So I kind of decided that I'd look at starting something out there. She's wasn't really ready to transition or anything at that point. So, and obviously no other clinic to purchase. So I just kind of started looking at doing a ground up. I went through a few different stages. Again, this is kind of like beginning of 2020 when I'm looking at this.
Ooh.
And so I kind of had this weird thing too, where I was negotiating with banks and talking to them, and then all of a sudden COVID happened, and it's like, okay, now all of the banks have different attitudes, and I kind of had to restart the conversation, approach different banks and talk to them about different things. But I started looking at buildings in Beaver Lodge and, kind of toying with that and trying to make numbers make sense and looking at like gutting whole buildings and, just kind of working with what you have in those types of situations. And it just seemed like a headache. Like every single opportunity that came up that was involved the previous building, there was just so many roadblocks. Like, we got to look out for this, like the building has a problem with this. There's a ton of stuff, and so I was kind of at a standstill a little bit, and then all of a sudden this lot popped up, and it was in a perfect spot. It was like right on the highway, reasonably priced, good visibility, good size. And so I just jumped on it. I mean, I was checking, the real estate page like twice a day kind of
Yeah.
thing. So
Mm-hmm.
I was probably the first that, within a couple hours message these guys. Anyway, and so ended up getting that and went through the whole process of developing the business plan and talking about building a building and developing a clinic inside and working with engineers and then contractors. We had the first contractor ended up having some financial difficulties, so kind of went through that process where we switched to a different contractor
A
who
lot of roadblocks.
ended up being a local guy.
A lot of
Yeah, just a lot
roadblocks.
of stuff where it's like, okay, like
Yeah.
time to pivot, got to figure out how to how to work around this, right? So yeah, we ended up using a local contractor who was great. I mean, he was a lot of fun when they finished building. Still comes by and does maintenance and stuff, but man, I missed hanging out with him almost every day out there. It was a lot of fun. So anyway, so they broke ground in January 2021, which is weird for here because usually it's very, very cold and the ground is frozen and stuff, but it was a warmer winter, so they were able to break ground, and building was finished it was probably finished in July, but we weren't ready to go until August, so we opened our doors at the end of August, and we've been running for 2.5 years now, I guess, and so we have 2 dentists, 2 full-time hygienists. We need more. Yeah, staff of
If you're
about
out there, if you're
10 to
in
12, depending
Grand
on the day.
Prairie, Grand Prairie, Beaver Lodge,
Yeah.
surrounding areas, hygienists, please. We need, please report.
I'm biased. I think it's
Yeah.
a cool place, but
No.
yeah.
And in this, what did you have in mind for your practice? So when it sounds like you're someone that really, I know you didn't think through actually going to dentistry, you said, until later on, but I'm sure when it came to the planning of the practice and then the final branding and what you want to achieve, the feel you want, what did that journey look like for you, and why did you decide on what you did?
Yeah. I mean, I think the journey is interesting because I feel like I'm still on it. Like every
Mm,
day is, trying to still work towards, and it evolves a little bit as time goes on, right? I mean, I think because you kind of see everything, right? Like, and you experience customer service in other parts of life, and I don't know if it's just me, but I kind of feel like in general it's been declining
mm,
in different places. I go to a coffee shop and stand at the front of the line. It takes 10 minutes for somebody to say hi to me. Like, I don't, yeah. I've been reading lots of books on hospitality and stuff, and it's hard to come by nowadays. So I think, like, ultimately, when I was thinking about what I wanted to do and what I wanted to turn it into was a place where, I mean, I think we're just constantly trying to exceed expectations, right? In every way. So, and again, we're still working on this. This is an everyday battle trying to improve and get processes in place and all that kind of stuff. But from the moment you walk in the door, like I want someone to kind of feel like I've never had that. Like, how cool does that feel that they know my name already? Like
mm.
they remember me. They're not like looking down at a screen to like see the picture or whatever. Like, no, they just know me. They offer me a coffee. They give me all the information on what to expect before the procedure so that afterwards, if something happens, I'm expecting it, right? And we have a plan on how to handle it and how to manage it. And obviously, I think that's a pretty big umbrella. Like, there's a lot of things that kind of contribute to that and help develop that. One of the big ones I think is taking care of the team. So that always, I don't know, you might want to edit this one out, but I'd be talking to other people before, and they'd be talking about clinics that they worked at, and the clinics would always say, okay, so our priorities are patients, team, and then money, right? But ultimately, it ends up just feeling about, or it feels like it's about money, patients, and then the team.
Team, yeah.
And I like multiple people told me this as I was hiring initially, and I kept thinking like, okay, like obviously that's a problem, but even the thing they're telling them, like in my mind, like how does your team feel when you say like, okay, so we spend every day together, but you're second tier,
Yeah.
like I mean, you look at any successful business, and they always talk about like you take care of the team, and they take care of your consumers, your customers, your patients, right? And I think like it's a little bit hypocritical just to say like, oh, absolutely patients come first, because then you have team members who are disengaged and not feeling the same way, right? I might feel that way, but they don't. So I think that's one of the important things that I mean, I've really tried to work on is just creating an environment where people are empowered and constantly growing and developing, and
Because the patient will feel
are all
that.
kind of
I
aligned
feel
towards the same
that
thing.
that's the thing.
Totally.
If you have a
Totally.
great team and a team of value, and you look after your team, and they love what they do, and they want to build this brand and this vision that you're sharing with me now, it spills over. You're going to get a better product at the end of the day for that patient.
Totally. Totally. Like, it's so fun. Like, it's it's one of those things where, again, you don't really think about it like, oh, I can't wait to see my team grow. Like, you don't think about that as like a high school student thinking about
Yeah.
opening a business or something. But man, it's so cool. It's so rewarding. I mean, you see somebody do something that they struggled with like 3 months ago, right? And you're like, I'm so proud. Like, it's so cool. Yeah, and I think it just translates into giving people good experiences everywhere, right? So yeah, working with the team's been a really big one. Obviously, I'm not perfect. It's a continuous journey to improvement. Quality is obviously important, and I think I've done far too much continuing ed, and I think part of it is probably a little bit of an addiction, I think, but I just
But you're better
love
off for
learning.
it.
Like, it's so cool to learn the different things. Yeah, like the different things you can do, and again, ultimately it's about improving people's experiences, right? So making a procedure more efficient, being able to do a procedure that provides more benefits, right? Like, I'm sure, like, we'll probably talk about the implant thing a little bit more specifically in a bit, but um yeah, ultimately that was the vision, is just creating a place where, it's not just transactional. It's everyone's kind of on the same page. We're working towards the same thing.
No, that's fantastic. I'm happy to hear that. That's one of the first times I could genuinely see that you saying that you meant it, because you have a lot of dentists that do say, like, my team, I put my team first, but I think the majority do fall into that bracket that you just said. And this is
Yeah.
not a bash on any dentist at all or anything. I mean, most business owners, at the end of the day, if you don't have a bottom line, your business is not going to run. But to truly,
Yeah.
especially in a dental practice, I had a lengthy discussion with Eric, our founder, yesterday, and we had spoken about with the wrong staff, you are putting your business at jeopardy. You're putting it up to chance, because just from what you've shared now already shows the emotion behind, yes, I need the right team. I need people in line with what I'm doing and to provide that patient experience. Otherwise, it becomes a problem. It starts to become a problem because the patient at the end of the day feels it. So that's where
Totally.
I also always encourage dentists, like, if you have a team member that's giving you trouble, you need to deal with it, because often it's not, or someone that's not growing in the business or not doing their part. Because at the end of the day, yes, most of us hopefully are soft-hearted human beings. We want to help each individual person, but you're rowing a boat with more than just that one person on that boat. And if it's causing the boat to not stay on track, you're affecting multiple families as well as your own, who is the dentist, and not just that one person. So I loved what you said there. It's a good thought to have. So, Doctor, the other thing I wanted to ask you, when it comes to treatment, so you told me the story about the practice now and essentially what's most important for you and as you evolved and the type of practice you're building. When it comes to treatments, what are your favorite treatments right now, and how did you get there?
Yeah, it's such a hard. Yeah, I think, and again, this evolves too, right? Like, when I talk to dental students, they're like, "Well, what should I do? Like, should I specialize? Should I go do a residency? All this kind of stuff." And I'm like, man, I still change. Like, it's so difficult. I mean, I love most procedures. You think about what makes you like what you do, and a big part of it is patient interaction and getting to know people and all that kind of thing. When I think about like the technical aspect of like actually doing the job, there are some things that are not necessarily the most technically demanding, and you kind of get into a flow where it almost becomes a little bit automatic, right? Which is good, and I think good for some people. For me, that's not what fills my cup.
You want to stay
And
engaged?
so then you start.
Yeah.
Yeah, exactly, right? Like, always
Yeah.
learning, always kind of problem solving, all that kind of stuff. And so I think lately it's kind of just evolved in complexity, right? I mean, restoratively, you go through all the COIS like PE stuff to learn how to rebuild things, and then been spending a lot of time with implants lately, and so a lot of the courses I've been doing lately have been full arch implant cases. So these are people who either have failing teeth where it doesn't necessarily make sense to go in and restore what's left and replace what's missing. They're in pain, they can't chew, they're self-conscious about what things look like. Or sometimes it's people who don't have any teeth and have been struggling without teeth for a while. So people in dentures that admittedly, I don't love dentures. I don't love making dentures. I don't love, I think at best they're a compromise, but they certainly serve a purpose. So it's people that have just been struggling for a while, and I think the coolest thing about this type of procedure is again the impact and managing the expectations, right? So I think a lot of these courses they'll have like a live patient portion to it, right? And so I went to one a while ago, and I just finished reading one of those books on hospitality, and again, it was all about like exceeding expectations and just going the extra mile to like change somebody's life and provide something that's memorable for a lifetime, right? And so these live patient components, usually the person comes in for a surgery and either has teeth removed or if they don't have any teeth, they just go straight to the implants, and the implants are placed, and either the same day or the next day, they have a temporary set of teeth inserted that have been designed, according to the person's face, so the smile looks really nice and all that kind of stuff. And it's brilliant. And I mean, from a marketing perspective, it's like an immediate testimonial, like the whole DSD, digital smile design, emotional reaction kind of thing. Oftentimes for the reveal, they bring in like family members and all this kind of thing, and they're filming and turn the person around as they see their new teeth for the first time, right? And it like there's something about the look on somebody's face when they go like, oh my goodness, like I don't have to hide my smile anymore, right? Like I don't have to worry about my teeth falling out when I eat a steak, or like all these things that have been like deeply impacting their life for years. Most times they've been solved. And I mean, like they got to modify their diet for a little bit, all that kind of stuff, right? But they can see the end
It's a
goal,
real
I think, as
solution.
soon as they look at their teeth.
It's a
They kind
very
of
real solution.
yeah,
Yeah.
exactly, right. I saw this for the first time at a course a little while ago, and saw the reaction. And to be frank, like this lady wasn't super expressive. Her like support system wasn't super expressive. She still broke down and cried, and I'm sitting there and I'm like, man, I don't know. Like after you see this, I don't know how you don't want to do this. Like
All the time.
this is the
Yeah.
most impactful thing. Like in like a day, you can go from 0 to 100. Like it's amazing. And so I think a lot of what I've been working on in the last little bit is just trying to get that process as efficient as possible, so that it's easy, it's as affordable as possible. Obviously it's not a cheap thing, but there's ways to make it affordable, make it predictable, so that you don't have complications, or we limit the complications and know what to do if we run into them. Basically just trying to work on systems and the team and technology and equipment to make it as streamlined as it can be, so that ultimately, I mean, I would love to be able to do that as frequently as possible, because it's again, like you kind of turn into a bit of an addict, I think.
that dopamine of seeing that. And have you had any recent cases or full arch cases that you've worked on that you would be willing to share with us?
Yeah. I don't want to go into too many details.
No, of course we want to stay HIPAA.
But
We want to stay HIPAA compliant on this podcast, please.
be reasonable. Yeah. I mean, a lot of them have involved, patients that have had extensive work done in the past, right? And they kind of get to a point where, they're not okay having something removable. I mean, it's not part of them, but they get to a point where we can't repair what's left, right? And so you take everything out and try to show them what stuff is going to look like. You get a blank slate, right? Which is one of the coolest things about this. We had a case recently where someone had some implants placed internationally, and I mean, it's kind of an interesting situation. Like, I think you talk to a lot of dentists about this kind of thing, like vacation dentistry, and immediately they get defensive. And oh, I get it. It's business, and you're losing business, and all that kind of stuff. I think it's, like, it serves a purpose, obviously. Quite often it's a little bit cheaper. My biggest concern is always communication and follow up. And admittedly, like, it's a tough thing to do research on, right? Like, as a consumer, as a patient, how do you know what quality is like? How do you know what to expect? How do you know what you're getting into, right? And especially if you go somewhere and there's a communication barrier, I think it can become very difficult. Anyway, so we're working on a case right now where this lady went down, and I would argue, looking at the records from before, it didn't necessarily look like this was her only option. A nice set of teeth. I think there were just some other more minor issues that personally I think probably could have been corrected in a different manner. But anyway, she had all these implants placed and teeth removed, obviously, and not a whole lot of expectations were set necessarily. So wasn't really told about what next steps would be. I don't think there was a lot of planning that went into it, which is the most important part with any of these, is trying to figure out, where you want to go before you even start, right? And so for one reason or another, didn't want to go back to have everything restored. And so we're kind of in the process of like unraveling stuff and trying to figure out what we can do to work with what we have to try to keep it affordable and conservative. Obviously, I mean, if you don't you don't want to do another surgery, if you don't have to do another surgery, right? But I mean, I think it's been rewarding in the sense that it's a tricky situation, and you kind of humanize it in the sense that that, I mean, it's not a decision that I, knowing what I know, would do, right? But I can, there's absolute validity in her reasoning and why she would have done that, right? It's just, I think it's hard to know what the potential concerns are and what you're getting into. So I'm excited to see what we can do to
produce something of value,
save things and turn it into a as good of a result as we can, right? So I mean, I think, like, my enjoyment from this so far has been taking a really complicated situation where, honestly, like, someone is really underprepared for what is going on, and really working hard to try to make it so that the information is digestible and I don't overwhelm them, and nothing is done incorrectly or anything like that. It's just trying to take somebody from, I think, realistically probably scared and confused and, like, unsure about what next steps are, to kind of knowing what's going on and understanding that we got a bit of work to do, and hopefully it's going to give her what she ultimately wants, smile back, right?
I like something that you said. There is definitely some uncertainty, and I think many people don't even know. They know the term all-on-4 or full arch, or these, or the idea of it, but when you look at some of the pictures and the complexity and things like that, I think your average person becomes scared, as you said, and they don't know. But one thing that I've seen over and over again is, although it seems like a big process, and which it is, I don't want to downplay it, but it's like there's a reason it takes so long to manufacture a Rolls Royce. There's a reason for it.
Yeah.
There's a reason why you need the right people to put that Rolls Royce together. And that's when I think of implants, if I think of full arch cases, these type of things. You're putting together a Rolls Royce, and at the end of the day, it's expensive, but it's worth it. It's worth it because you're not going to have to deal with the things that you dealt with before. As you said, the dentures falling out. It has a role, but yes, it has its limitations. And if you're looking for that Rolls Royce type of treatment and a solution that's going to actually last and feel like your natural teeth, that's what excites me about these all-on-4, all-on-6 type of treatments.
Yeah, absolutely. I mean, I think, like you say, for me, this has always been a little bit of a battle, because some people just take out, like, someone will have a perfect set of teeth, right? And they believe so wholeheartedly in implants that they're removing perfect teeth to put implants in. And I feel like I really pride myself on saving, like, like, I'll throw a Hail Mary to try to save a tooth that I think most people would want to take out, as long as it makes sense, right? In the grand scheme of things, like everything else is okay. Like you say, I mean, there's a ton that goes into this. It's not a cheap endeavor by any means, but it's also a major undertaking, right? Like there's a lot that goes into it in terms of diagnosis and treatment planning and figuring out where the teeth should be in someone's smile, verifying that with them, right? Getting the right components, operating the surgery properly, and kind of minimizing someone's discomfort and trying to ensure that they have the most comfortable process as possible. The design of the prosthesis and knowing how to take records, and like there's so much that goes into it. And I mean, you talk about a Rolls Royce, like we just work to make it as efficient and as predictable as possible, and take all these complicated steps and try to streamline them so that, obviously there's a lot of individual variations with things, but the highlights all kind of stay the same, right? It's easy for us to overwhelm people with stuff. I mean, you listen to all these people talk about case presentation and talking to patients about what's recommended and what would benefit them and all that kind of thing. And in my mind, I've kind of gone through a couple evolutions in school, and shortly after, you see the dentists have been practicing for a long time who are just kind of like instructional, right? It's like, you need this. And don't say much more, just leave it to the hygienist, and they'll sort it out. Maybe they'll book, maybe they won't, I don't know. And then as I went through school and shortly after, I did all this CE, and I was like, okay, yeah, it's all about educating people like crazy. And I mean, obviously that's important. Like, people want to know what they're getting into, and risks and benefits and alternatives and side effects and all that kind of thing. But what if the person doesn't care? Right? Like it was like this major thing that, there's no qualification to like try to figure out if you're even talking about the right thing. Like maybe that person has a million other things going on in their life, and this is not at the top of their radar, right? And so I guess the last evolution, and to me it seems like the most correct one is just trying to figure out what is important to the person, right? Like, people can come in with the exact same situation, say they're missing all their teeth, they're struggling to eat, all this kind of stuff. One person might have a family member that's really sick that can't think about anything else other than that, right? What the heck am I doing talking for half an hour about what they need to fix their teeth, right? They don't care. It's not they need to go take care of their family. Whereas, you have somebody else that comes in, and you try to engage them in a conversation and figure out what they care about. And top of their mind is not being able to eat, right? They're really concerned about the dinner party that they went to, and their teeth fell out as they were eating something, right?
Yeah.
And those are two very different situations. I mean, once you kind of have that understanding, then all of a sudden it's easy to talk about what are your expectations, and this is how I can meet them or exceed them, essentially.
I love that.
And from there, then you can talk about all the nitty gritty.
Yeah. No, I really like that. And to bring that together, if I'm a person out in the Grand Prairie area now, Beaver Lodge or surrounding areas, and I'm struggling with either missing teeth or something I'm embarrassed about, or I'm scared to come to the dentist, why should I come see Dr. Adam Woods? What would you say to me? Why would you encourage me
I have to sell
to
myself
take that
here.
step?
I think one of the most important things that I've heard with difficult conversations is that at the end of the day, it's just a conversation, right? And so I think like someone in that situation, a lot of the fear comes from like, oh man, like that sounds like a lot of stuff. It's going to hurt. I'm going to be really uncomfortable. It's going to cost a lot of money. I don't have that kind of money, right? But that's not the first step. I mean, that's, the first step isn't come on in and we'll do all this in one day. Like, to me, that makes no sense. Ultimately, I guess if I'm plugging what we do, the first step is just coming in and having a conversation, right? My goal is to figure out what's going on, what's bugging you, what's happening. Maybe this isn't the right thing for you, right? But maybe I can offer something that at least improves your situation so that, your confidence is better, your function's better, whatever it may be. So I think, that is probably the most important thing. Like it's totally dependent on what somebody wants. That conversation, the first conversation is just set up so that we can kind of get an idea what somebody wants, what their expectations are.
And you're there to help.
If
I mean, that's my,
what somebody decides to do.
yeah,
Yeah.
that's my idea. I think there's a misconception of
Yeah.
like the again, and this goes back to this idea of dentists. Like, I don't understand why there's this idea that dentists are any less like warm-hearted, like loving people that just want to see people do better. Like, I don't know why that is not universally just accepted, because at the end of the day, the only thing dentists do is try and help people get out of pain, look better, smile better, be happier with who they are, not hide their smile. Like, all of those things are positives to me. And yeah, maybe it's a bit uncomfortable relative to some other type of medical procedures or things like that, but you're also working on something very intricate and something very complicated. Your mouth, your teeth, the nerve system, the enamel, all of those things are difficult things, but that doesn't mean it's something to fear. It's just something that maybe takes a bit longer. As you said, it takes a couple of more conversations and figuring out what needs to happen.
Totally. Right. And figuring out what barriers are, right? If it's anxiety, like you're saying, I mean, hey, like you go through all this stuff and try to figure out what the barriers are, and then offer a solution, not saying, oh yeah, we got this, like it'll take care of that. Like, well, we have sedation, and this is how it can make that better for you, just so that it can make it easier for you to get what you want, essentially, right? Yeah, like you say, I mean, it's you kind of take it for granted, especially I know I did, like right out of school, you're doing fillings and doing all this kind of stuff, but man, it's someone's smile, it's someone's ability to present themselves confidently and feel good about smiling on a first date or a job interview, or be able to eat a meal at their granddaughter's graduation or whatever, right? So yeah, it's a privilege to be able to do what we do.
Stunning.
Yeah.
That's a good note. With that, Dr. Woods, I want to say thank you so much for being here with me today, and that we could chat a bit. I think a lot of young dentists can definitely take a page out of your book. Yeah, thank you for being hungry in what you're doing. I'm excited to see where you go. Definitely, with how hungry you are to keep learning. I'm sure as dentistry advances, you will be at the forefront. So keep on keeping on, and thank you again for being here.
Thank you, Ian. I appreciate it.